Sayal and you are watching my YouTube channel Adore.Learn. So today we are going to talk about migraine, so let's check it out. So basically friends, the migraine is a form of headache and it affects more women than men. So the migraine is 20% common in females and only 6% common in males. Now, the pathogenesis or the procedure of disease formation is actually unknown, but many theories are presented. One of them is extracranial vessels or the vessels in the brain, they are actually distended. They increase their diameter and then it causes the pulsation in your head or the pain. As the clinical features are concerned, let me tell you that the headache of migraine is very throbbing and pulsatile in nature. I'll show a video next and you will just observe how does it feel. Now, the clinical features, they last for approx 4 to 72 hours and the intensity is moderate to severe. So here we go guys, this is the visual and it shows the migraine in your head actually. Now we are going to talk about triggers of migraine. So the most important trigger is estrogen. Estrogen is basically a hormone and the fluctuating level of estrogen during your menstrual period, during pregnancy or after menopause, they are very bad to trigger migraine attack. Now the next thing is coffee and alcohol. So coffee contains caffeine and caffeine is a trigger for migraine and alcohol too. Now the stress at home or work, it is always a good trigger for migraine. Now the bright lights and sun glares, they can also induce the migraine. Strong smells like paints, perfume, loud noises can also trigger your migraine. Certain medications like oral contraceptive pills and vasodilators like nitroglycerin, it can also aggravate your migraine. Cheese and chocolate, I have described the effects of chocolate in my last video, you can just check it out. They also trigger the migraine and chocolate is the second most common trigger for migraine. Some people have sleep disturbances, means that missing sleep and getting too much sleep may trigger migraine in some people. Now the stages of migraine, the first stage is a prodromal stage. 1 to 2 days before migraine, you can notice subtle changes that warn about upcoming migraine. Features of migraine include, it's a prodromal stage basically, the constipation, depression or euphoria. Euphoria is actually the feeling of wellness and happiness or beyond. Food cravings. Now here the food cravings are basically for chocolate and also the neck stiffness, but sometimes. This is the most interesting stage with aura headache. Let me tell you what is aura. Auras are actually reversible symptoms of your nervous system. They build up over several minutes and last for 30 to 60 minutes. It includes many things and I'll be showing you next. Basically, it is also called classic migraine and it's just 20%. Now you can see these are the zigzag lines in front of your eyes during migraine. And this is a shimmering effect. People of migraine, they usually feel blurring of vision. So the people and the lights, they look like very blurry images. This is a scotoma or the black spot in front of your eye. Along with these changes, there are also some tingling or pin-pricking sensation in your arms and leg. There could be a visual loss, there could be weakness or numbness in your face. It's hard to speak and you can hear many noises, your body could have jerky movements and so on. This is actually the bright light for your eye. So if you are having a migraine attack, you can experience all these symptoms at once. Now this is the last stage called post-prodromal stage. In this stage, your body may feel very confused and fully drained, like this little kid. As far as the diagnosis is concerned, it is totally dependent upon the clinical features and patient's history. When we talk about the treatment, the most important thing we need to understand and we should tell our patients that you should avoid triggers. There are many triggers, whichever trigger suits you, you need to avoid. Analgesics or painkillers are given like NSAIDs, aspirin and paracetamol, but NSAID or non-steroidal anti-inflammatory drugs are the best. Now friends, for severe cases, patients are given triptans like sumatriptan and they are serotonin agonists. I have talked about serotonin in my last video that it's a happy hormone or a neurotransmitter and it is more frequently present in your bowels. For the preventive therapy, we use the preventive therapy if the episodes are more than 2 to 4 times per month. And for preventive therapy, we can use beta blockers, anticonvulsants, calcium channel blocker, and tricyclic antidepressants in which amitriptyline is the most common. Thank you so much for your attention. Hope we will meet soon. Please don't forget to like, subscribe, and share my video. We'll meet soon. Khuda Hafiz.